Hello, thanks for joining me. Happy Friday. I am Julie Hirschberg, the owner of Re+active Physical Therapy and Wellness, a neurologic PT and fitness practice in the Los Angeles area and home of the Schmidt Movement Disorders Fellowship, which as of right now is the only neuro-based fellowship program for PTs in the country. And one of the reasons that we are going to dive into functional movement disorders yet again today. It's a really exciting time for our fellowship right now because we have actually tomorrow, this weekend, this nice transition time where we celebrate our current fellows finishing the fellowship. So that's Claire Cronenweth. She's finishing the fellowship. We have a new fellow starting as well. So we're just all in it. We do a really fun day with UCLA and go through our research and things like that. And that's tomorrow. So one of the reasons that we are diving into functional movement disorders is because it is a large part of our own practice at Re+active. It's historically not well understood. And a lot of people go through many doctors and other healthcare professionals before really having a definitive diagnosis. And by that time, they're feeling pretty hopeless. And one of our themes for this year, one of my own themes, is about hope. And so today we were talking about hope in functional movement disorders. And one of the other pieces I have to say about this topic is that my colleagues and I, so Chelsea Richardson here at Re+active, Carly Lakala at Oregon Health Sciences, and Mike Studer, who's also up in Oregon, we are preparing a CSM presentation for February. Actually, it's on Valentine's Day at 8 a.m. if you are there. And it's called Functional Movement Disorders. It's not in your head. And so with that preparation, anytime you prepare for like a huge national presentation, like you're diving into a lot of literature, stories, really talking to experts in the field. And that is what we've all been doing. That's what I've been doing. And there is a very clear message of hope for people with functional movement disorders. So I'm really excited to share that hope with you today. So what we're going to talk about today is why there's hope for recovery with functional movement disorders, how having a definitive diagnosis starts that hopeful process, and how a functional overlay in another neurologic diagnosis. So this is if you have a neurodiagnosis and you might have some functional cognitivity problems in addition, it provides even more hope for recovery. And in particular, I get excited about this topic because this is something that Dr. Alan Wu, a movement disorder specialist that we work with a lot at UCLA, who's part of our fellowship program, who actually is teaching a course with us for our fellowship next month. This is something that he talks a lot about, and I find it really fascinating and again, very hopeful. So thank you for joining us for this hopeful session, I think. So I want to start with what is a functional movement disorder, just in case you weren't familiar with that. So functional movement disorder is a movement disorder that is characterized by involuntary movements, involuntary but learned, habitual movement pattern that we understand now is driven by an abnormal self-directed attention. And that's important because that actually becomes part of the treatment. And one of the things, and actually I had really the pleasure, I love teaching so much. I had the pleasure of having my first day of the semester at USC. I teach neuropathology to doctoral physical therapy students, and we had our first lecture, and I got to talk about this because what's important about a functional movement disorder, it doesn't fit in a nice, neat box of neuroanatomy. So I teach this, and functional movement disorders defy that system. They don't fit in a box, and that makes it very, very frustrating. They're not due to an isolated neurologic lesion, but instead to overall function or connectivity in the nervous system. And now, in our current time, as opposed to 20 years ago, we have a much better understanding of the physical, the social, the psychological influences and connectivity in the brain. And because of our understanding, functional movement disorders are better understood. Now, in the past, these might have been called something like hysteria or conversion disorder or even a psychiatric disorder. But we know so much more now that those terms don't accurately reflect the nature of the disease. So let's start. That was just background. What are we talking about? But let's talk about hope for recovery. And this is what I like to talk to my own clients about, to the students about. So because functional movement disorders are related to a connectivity problem in the brain, there's actually a lot of potential for the physical therapist to drive the neuroplastic changes to change those connections, to reconnect what needs to be connected, to undo some patterns that shouldn't be there. And at CSM, actually, we're going to share quite a few cases. Between all of our clinics that we work at, we see a lot of people with functional movement disorders. But for example, we have had several paralysis of one side of the body, difficulty moving a leg or an arm, for example. Excuse me, and through targeted therapy, which included a lot of use of those motor control, motor learning principles, we're able to take people who were in a wheelchair to running and getting back to CIF level sports and basketball and things like that. And I'll share a couple of videos with you. We actually have a playlist now on our YouTube channel. I'll share a link to that because we have had patients really want to share those stories with you and show that recovery. And that gives me a lot of hope to see somebody going from a wheelchair to running again. But it's not just my experience. It's not just other clinicians' experience. You see this in the literature. So we won't do a full literature review, but actually seeing the evidence gives me a lot of hope. There are a few studies that have looked at physical therapy in particular. Oftentimes it's in an inpatient rehabilitation setting, so where they're going for a week, 5 days a week, several hours of therapy a day, multidisciplinary team. And those studies are showing that people have really great recovery just in that week. So 65 to 80% improvement. And a lot of these studies actually have been done in Europe, but there are some studies that have been done with centers here in the US where they have a program for people with functional movement disorders, and they find similar results, including outpatient programs. And there's a huge study that's starting now. Again, this is in the UK, but they're looking at doing this on an outpatient basis. And that's certainly, I'm at Re+active, I'm not on an inpatient unit. When we do this, we typically do this in an intensive way. So typically over a 4-week period, doing 3 to 5 times a week of PT, OT, and yoga therapy, and doing it in a way that integrates with the physician, a psychologist, if that's part of the team as well. So the evidence shows that recovery can happen. It can happen actually in a short period of time. And one of the things that I really emphasize with the people that I work with, and when I talk to other clinicians, this is a big theme, is that recovery can happen and it can continue to happen even if you have some sort of relapse or change. And there's actually this really lovely graph that John Stone includes in a brochure that he has on functional weakness. And I really love it. But essentially it shows recovery and it shows the waxing and waning the fact that you might still have some days where you really feel like you're back to square one, but you're still on that trajectory of recovery. And it doesn't mean that you did something wrong. And this actually happened in the case that Chelsea will be presenting at CSM. The person did have a relapse, but the recovery kept occurring. They were able to get back. And that trajectory and some relapses, it's actually a normal part of the process, and it doesn't decrease the hope for recovery. It's actually part of the process. And when you see that trajectory of recovery occurring, it should be a sign then that even if you have a relapse, it's going to be okay. So there is a lot of reasons for hope with functional movement disorders for recovery with physical therapy. So now let's talk about why having that definitive diagnosis is part of the very first steps of hope. And this is why it's really important to me to have a movement disorder specialist as a part of our team to be able to give the definitive diagnosis. So one of the first things is that definitive diagnosis, the explanation of symptoms, the explanation that we're not just ruling out many other things, but that there are positive findings that point to a functional movement disorder. This provides hope. Hope that you do not have to see 20 more doctors and have 50 more tests in order to know what's happening here. So this is happening more and more, that we're seeing movement disorder specialists able to make a very definitive and positive diagnosis. And once you have that diagnosis, then you can move on and go, okay, then what's next? And the good news is, you know what, it's not necessarily medication or a major surgery, but actually therapy that can help restore those connections. And I want to bring up a question that actually somebody emailed me this week, where she said she actually has 2 patients with functional diagnoses and a lot of testing, a lot of negative test results, negative imaging studies, and the patient is frustrated and not really understanding the diagnosis. I can tell you, for these people, it's so important to have a movement disorder specialist be able to make that positive diagnosis on positive findings, not just all these negative tests, but positive tests, of which there are some. And in fact, I'll talk about this at the end, but I actually made a little cheat sheet, and we'll go over it at the end. I was working on this for our fellowship group that we have here as we go through some deep learning and growing together. And I'll share with you a few of those tests and findings that can be done. And one of the other questions that this therapist asked then, you know, what is a clear way to explain the mechanism of the functional disorders and assure people that it's real and that it's not made up? This is so difficult, especially when the person has been told that they're making it up. So I think this is a really important part of the hope. And, you know, what I tell people first and foremost is, look, like, we've seen people with functional movement disorders, and it's actually more common than many people know. And what we see is that people can improve and change, and we'll actually share them videos that we have permission to share. For example, there's wonderful resources on the neurosymptoms.org that you can share to have those enhanced expectancies and those vicarious experiences for people to see the hope. And what I'll tell people as well is I will talk about this hardware and software issue. And I think most of neurology, most of medicine really understands hardware problems. You have a stroke and you have a lesion in the cortex. You know, you have a tumor and there's damage to a particular part of the temporal lobe. But with a functional movement disorder, it doesn't show up on an MRI, at least not a standard MRI, maybe on functional MRI imaging, but it's a problem with the connection or a software issue. This is an analogy that many people use. John Stone uses this analogy. That's a really nice way that I've found to help explain it to people. So the last piece that we wanted to talk about for hope, and this is another piece that I really love that Alan Wu has explained. He, by the way, is doing a course with us this month on differential diagnosis. And he talks about trying to distinguish when there is an actual neurologic diagnosis, like something like dystonia, but there might be a functional overlay, and how that actually might give us some hope for recovery. And I'll give you just a really short example. So I was working with somebody with cervical dystonia, and a very brilliant colleague of mine, Chelsea Brown, we were working with her together, and Chelsea Brown said, let's do a little more heavy dual task and distraction. And that's actually part of the testing for a functional movement disorder. She had her walking backwards and doing math along the side of the treadmill, looking down. And you know what? Her dystonia was gone. And this was a really good example that she might have a functional overlay where the distraction really unmasked some great potential. And that's what we find with functional movement disorders, that some other tasks, dual task, increasing the automaticity of movement, taking away the attention to the movement, can actually unmask some really great potential. And I use that then to share the hope. Whoa, look at that. Look at how much potential you have when we unmask it, and how can we do more of that and have that carry over into everyday life. And I think this gives really great hope for recovery. So Alan Wu actually presents this really nice diagram to show a neurologic disorder and how you might have a syndrome with a functional overlay, and talks about this specifically with dystonia, but how that functional overlay actually is very amendable to physical therapy. So that's exciting to me. This really drives me, it makes me really excited to work with people with functional movement disorders. And I think we have a lot of hope for recovery based on what we know from the literature, from the mechanism, hope when a definitive diagnosis starts the process, and hope for neuroplasticity that we can help drive, even if there's another neurologic disorder. So I hope that gives you some hope and some ideas of what can be possible with a functional movement disorder. And I just want to thank you so much for joining me in these. I really enjoy sharing what I'm learning and sharing that with you all. And I will put some things in the comment because there's a lot of great resources. In fact, there's an organization called FMD Hope, great organization. You should follow them on Twitter. Actually, they have a lot of great resources. And if you need another dose of hope, join us for our course with Alan Wu. It's on January 23rd, and we actually record the courses so you can see it after that. But I always get a lot out of working with him and problem-solving cases with him. And the last thing I can share with you is that I shared last week, our clinical mastermind application just opened today. And we already have a few applications coming in. It goes through January 17th. You can go to our website at reactivept.com/mastermind if you want to learn a little bit more and want to join us on this journey of really learning deeply so that we can help people with neurologic disorders even more. So I'd love to hear from you. I hope you have a wonderful week, and I will catch you next week.